Well, the project centres around exploring alternatives to making complaints and raising issues in care. And also examining maybe what's good about complaints and what was bad about complaints, and getting people's suggestions on how they think things could be improved. So use that and use the quality improvement tools to actually, measure that properly. And the course actually was foundation,
the foundation.
For foundation for that. It actually came about that findings did agree with what some of the things I was believing at the beginning, and it gave that more measured approach to it. It gave it more authenticity, I felt, by doing it this way, rather than just saying, well, people tell me that they think, there is a better way to, raising issues about care other than making a complaint. Not in all cases, but in many cases, there's a better approach to it. The project, at the end of the day, what happened was, in the time that I had available, we actually created a poster, which will be used as a tool in the future for other work. The poster has been used for an event in the non-acute sector and has been put up on display in the non-acute areas. Hopefully that it will be spread around the hospital and other areas as the time goes on. The abstract for the work has been accepted for the forum for quality and safety in healthcare in Glasgow the end of March. So I'm really pleased about that and hoping that raises some good publicity for the work behind it. And we hope also to build on the work carried out so far in the study to explore more ways of look at the more human side of raising issues in care and the complaints process and the impact it has on all stakeholders, on staff and on patients and on carers, and perhaps be able to create from that, explore the possibility of creating some learning tools to help increase empathy between all stakeholders and say, well, this is how we would feel about it. And I know that won't be an easy task, but with small step changes and continuous improvement, I would like to think it would make some inroads to that in the future.
So, Carol, just to build on that, you do sound so enthusiastic about it, but where did the idea come from? Where did this idea about the complaints and the challenges around that just develop from, for you personally?
For me, I think I have been a long-term patient for 40 years, and there will be things that go wrong in care at times, and I was once given the wrong drug.
Right.
So, but it was all sorted out very, very quickly, and staff moved in. They were very, very open about what happened. There was great transparency, and there was actually learning. I know there was learning gained from it, and the whole thing was sorted out in 3 weeks. And then another time, many years later, there was a problem with care in a completely different area, and I was just told, go make a complaint.
Okay.
And I just felt this was not suitable. It was not a suitable topic to become involved in. Complaints process was too clinical, it was too complex, and it could have caused more harm than good, and it caused arguments that were unnecessary, where I had always said I don't want to make this complaint, and I still think that that complaint should never have been made. Somebody should just have sat down with me and said, talk me through it and work the problem out, rather than just say go make a complaint.
Yeah. Very good. Well, that is good insight, and that sounds like a really good driver for everything that you've been doing. So I'm glad that you've went through the process, because now we have another QA champion to follow us through and to help us along. Yeah.
Well, also this discussion will be raised not by me, by other people in groups and at events, and there has been a lot of consensus that complaints aren't the way to go.
Yeah.
So I knew that people were agreeing with me. This was not. You can't avoid all complaints. and for legal reasons and all, there's some you can't avoid. It has to be done formally. Some you cannot deny people the opportunity to, make a complaint if they want to make one. But I think there should be other opportunities available for people to be able to say, no, I don't want to make a complaint. I just want to sit and sort this thing out. I don't want to get into any arguments over it.
Very good. That's very insightful. So let me ask you a few more questions to really tease out your experiences of the project. So firstly, how did you hear about quality improvement in the Southern Trust, and how did you hear about the chance to work on a certificate or an award course?
From memory, it was actually posted on Twitter by the Southern Trust. Whoever looks after the Twitter, on their
the communications team look after the Twitter page. Yeah.
Well, that's where I seen it, and I thought about it for a while, and I mulled it over and thought, should I take this on along with other things? And then I thought it would be a very, very good idea to take it on. Good. To move things forward.
So, were you excited about the chance to do something like this?
I was, because I kind of realised this could be used as like a launching pad for my ideas. It would make them more robust, make them, as I said before, more legitimate, add authenticity to them, and to be able to actually, it give you a chance to actually sit down and work with people and measure responses and to things, and look at it properly, not just have a discussion around the table, which is fine for throwing about ideas, but isn't fine for implementing them. And the other thing, it's not only about the continuous improvement, making sure you've got continuous improvement. I think it's also about knowing that you don't make a negative impact by something that you do. And I think by that, the continuous improvement methodology, it prevents that, because somebody will twig on. You have to work in teamwork, and somebody will say, that's not the way to go, or this could cause, a problem further down the line if you progress this further. So problems can be nipped in the bud rather than just coming in and say, I think this is a good idea, let's implement it. You actually need the quality improvement to do it.
Very good. So you mentioned teamwork there. Did you have a big team to help you, or did you have to build up your networks as you progressed through?
Well, I had to approach people, but they were very, very, very supportive. They actually, staff had put me in touch with other staff, and that's how I was building up networks. I had networks of patients and carers already, because I'm involved in the personal and public involvement panel and the trust, and I've been involved in other initiatives over years, so I would know staff, but I did need to have introductions made within the trust to build up those networks. But that actually worked, because people were supportive of what I was doing.
Brilliant. I'm glad to hear that, and I'm glad to hear that so many other people thought there was value in what you were doing, and that's what we try to do, and we try to learn and share from each other. So when you started this whole process, did you encounter any difficulties or any challenges that might have put you off to begin with, or were you able to work through them okay?
It was all quite new to me.
Yeah.
And you look at everything, you think, no, this is going to be okay, because I'll find out how to do things as with each step. But then you start looking and you think, what's that? But it does, you work your way through it, and you learn from it, as you go along. And then you realise this does really work. I mean, you look at something as simple as a fish diagram. That sets out the benefits and the disadvantages of something very, very clearly in like a visual picture, and it shows maybe where you're at the minute and where you're trying to go from or get to, better. I think that visual presentation of material is very, very helpful. It's very detailed. You need to have a record of everything you do. You need to build up your stakeholder groups and keep a record of who they are too. It's very, I I felt it quite intense the way it, because there was so much detail in it. But at the end of the day, it got where I wanted to go, you know, and easier rather than just, as I say, go jump from A to B without anything in between, because people wouldn't have taken that maybe as seriously, and I could show them the analysis of what I had, which people seem really like, and that's why this next move is coming on. There are plans now to create the co-design group, but that's based on the analysis of the data from that course.
You're thinking about spread and sustainability. These are real kind of buzzwords from quality improvement. So what's next for this project, if you want to maybe elaborate a wee bit on that?
It would be to continue using that data and building on it even more, as you say, increasing the spread through the co-design group, through meeting other people, getting other ideas, because not all my ideas are going to be, they're definitely not going to be perfect. They can be improved upon. Other people might have better ideas. And we would like to think that we could look at this in a way that very, very sensitively, because a lot of it too is going to be qualitative data, and a lot of it will be about changing the culture too, improving the culture. So I think we do need to be very, very careful and look at it sensitively. I don't think it is going to be easy to do, but I think any kind of information, I think what came out of this course was that there needed to be more communication and information and early intervention, and those are main messages that are going to come through in the next stages, I would imagine. As will a more personal public involvement approach and more partnership work, and to try to find ways maybe to increase awareness of the impact and the negative impact too. I don't want to be biased about it, because you could look at the positive impact, but also to look at the negative impact of what it's like to be complained about, or what it's like to be involved in the complaint.
I'll maybe draw back to when you started this project and some of the things that were going around in your head in relation to should I or should I not get involved in quality improvement and with the Southern Trust. And were there any costs that were maybe playing on your mind before you started this, maybe financial or time or anything else that might have played on your mind before starting?
Well, it certainly takes time, and it took a lot more time than I thought it would. I think that was, I think everybody believed that, it wasn't just me. You think you're going into this to do this for a 4-month course, and it took longer. And it took a lot more work than I thought it would. I thought, this won't be too bad. It's level 3. It's not the highest level, but it was difficult enough. I don't want to put anybody off, because it was well worth it. Cost money financially. It didn't really cost me anything financially, apart from maybe some travelling expenses, but not that it wasn't that high. Everything was provided by the trust. The materials are you need it electronically, and you were given your file. I mean, what else did you need apart from your time and some travelling expenses? With
all that you know now, is there anything that you would have done differently at the very start?
I think I would have been maybe a wee bit more mentally prepared for going into it, that there was going to be more work today, rather than get shot or in the middle of it. Sort of, I think the problem too is that you need to get, because it's teamwork. You're going to have meetings, and the meetings, to get everybody together in one place is just a nightmare. It's not easy, and it takes time. And you can sit for 2 months in a 4-month course waiting for a meeting, before you can get everybody together. So you can use emails more, of course, but sometimes you need these face-to-face meetings too, and you just can't avoid them. So I'd be better prepared for that, because I think I was getting a wee bit, there's nothing happening, and then you could fall back a wee bit and think, you'd lose a bit of momentum. I should say a bit of the passion. And then when you started again, the passion would start again. Yeah, I can do this. And when I got to the end of it and I was writing up, the scope and spread and things like that, I was getting really into it again, thinking this is turning out really, really well, and it was worth it.
Thinking about the course itself, how do you feel the learning and the completion of the course and the completion of the documents went for you? Did you find that a challenge, or did you feel supported through that? Or did you find it an easy process to get through?
The whole thing. I was well supported. I was maybe sitting at one end and things weren't happening, and then I'd get this email, "Are you all right? Do you need any help?" And I'm going, I'll get to you now, I just have to get somebody, because if you're chasing after people, and trying to get teams together, and then when you do lose that wee bit of momentum, you're sitting back and you're working on something else, and then you think, oh, I haven't done that, and then this voice over the internet comes from the quality improvement, somebody in the quality improvement team. You okay? Which means, where's your work?
You know us too well.
Yeah.
Very good. Very good.
No, they were very, very supportive, and I got great support.
Would you recommend doing something like this for other service users?
I definitely would, because it has raised awareness, even if it didn't go beyond to the co-design group, if it didn't go any further than now, it has raised awareness of what I'm doing, with different people around networks, and has raised awareness of maybe some concerns around, don't just say to everybody, make a complaint, there are better ways of doing things. I'm really, really pleased about the abstract being accepted for the International Forum on quality and safety, and healthcare safety. So I think that, has made it, has added a big bonus. I wasn't really expecting that to happen. But I think that I do intend going forward, but even if I didn't, I think the fact that it's been there, and it has brought this out more into the open about thoughts on this. People were talking about it behind the scenes, but I think this has raised more awareness of it. Even at this point, it never went any further. It has had. I would recommend people to be able to do it for two reasons. If you want to get something done, it's a better way of getting it done, a more legitimate way of doing things. And through the quality improvement methodology, you also, you can measure it, measure what you're doing, and the improvement. So it's for that two reasons, to have that structured approach and to doing the thing, and plus having a launch pad for your ideas. It provides that. If you have an idea and you really want to get it through, that's probably the best way to do it. To actually to have that structured approach. Well, I would actually like to thank all the quality improvement team and the staff from the older people and persons directorate, the people who are working in the Southern Trust PPI panel, the stroke. The stroke, chest heart stroke group, carers group, and hopefully I haven't forgot anybody. Hopefully, if I have, I'm sure there's other people who have helped me out there in this, because people have been very, very helpful.